In this video, I'm going to explain how to do neural manipulation for obturator nerve. Obturator nerve is from lumbar spine and it passes inside of pelvic girdle and it shows up from obturator foramen and it goes all the way down to inside part of knee. It innervates adductor muscles. It also innervates inner part of hip joint. This is sensory division. Also, it innervates a skin sensation of medial part of thigh and medial part of knee joint. Interestingly, some researchers say obturator nerve innervates PCL, posterior cruciate ligament. That's very, very interesting. Again, adductor muscles, inside part of hip joint, inside skin sensation of thigh, and inside part of knee, also PCL. Now let me show you how to do neural manipulation for obturator nerve. As I said, obturator nerve is on medial part of thigh, and it's better that you flex hip joint. Why? Because in this case, you can approach to obturator nerve better. However, this is a mistake I used to make. As I flex hip joint, obturator nerve should come with femur, right? Because it doesn't come, it's like, weird orientation. If hip is flexed, nerve should come together. But I was not thinking about this relationship. So in my mind, obturator nerve was still, kind of vertically this way. So I missed this relationship. So I could not find obturator nerve very easily. So please remind, obturator nerve should come with femur. This is very, very important. And let's imagine there is thigh. I hold thigh like this. This is left thigh. And I use left hand. Left thigh, left hand. I use thumb, okay? Now I approach to this part, very close to pubis. Remember, I flex hip. Nerve come with hip joint. Now I feel very kind of stringy kind of feeling close to pubis, okay? Now I can put little bit stimulus, just tiny bit with my thumb. If I exaggerate, it's like this, not this one, just tiny bit. And you off pressure a little bit. Let's say you put stimulus like 5, let's say 5 kind of a percent of stimulus, then you let it off like 2 or 3%. You don't completely let off, okay? Let's say 5 stimulus, put off like 2 or 3. Now, nerve starts to move. You follow the movement of nerve. This movement is very, very random. It can move medially or laterally or longitudinally, or maybe it feels like spiral movement. It depends on however nerve moves, okay? But not that big movement. It's very tiny movement. It's almost invisible from outside. Again, flex hip. Please be noted, nerve come with hip joint. I use thumb, left hand, left thigh. I hold thigh. I approach to the proximal part of obturator nerve with thumb. Put a little bit stimulus, let's say 5 stimulus, then let it off like 2 or 3. Now nerve starts to move. You follow a movement until movement is down. Obturator nerve innervates many things. Adductor muscles, inside part of hip, inside part of skin sensation of thigh, knee joint, PCL. So impingement of obturator nerve can have big effect of medial part of lower limb. This is very, very important thing. At last, obturator nerve is very close to ovary, ovary. If somebody has weird pain, the cause is unknown, maybe ovary is pressing against obturator nerve. Okay, so this can be one possibility for unknown cause knee pain or lower extremity pain. Why? Because ovary is very close to obturator nerve. So in this video, I explained how to do neural manipulation for obturator nerve. If you liked today's video, please hit the like button, comment and subscribe. See you next video.